Now, I have great pleasure in introducing our Neighbourhood Transformation Team Manager, Ancha Stoodley, to the stage.
Wow, what a welcome. Thank you, everyone. I'm Ancha Stoodley, and I'm the Neighbourhood Manager at Building Futures East, responsible for delivering the Lifting Neighbourhoods Together approach in Walker. That said, and out the way, I do feel that the title isn't really truly fitting. I do feel I'm here today really as a representative of Lifting Neighbourhoods Together. It isn't an us and them project, it's a whole community approach led by the community. Everyone involved in Lifting Neighbourhoods Together brings experience, be that lived experience or otherwise, passion and immense dedication. And because of this, we are all excited to be here today. So that's community members, which we'll have a lot of here, volunteers and also staff members too. And we're here to share the learning and celebrate the Walker community. So we wanted just to start by showing a short film that we recently put together with the help of the amazing filmmaker here, Ben Smith. And there'll be an opportunity to see the longer version of the film later in the day. So just bear with me.
Neighbourhoods Together is a 5-year programme funded by the National Lottery Community Fund, a partnership between Scottish charity Community Renewal Trust and Walker-based charity Building Futures East. Lifting Neighbourhoods Together builds on over 20 years learning from Community Renewal Trust. It's about bringing everyone together to improve quality of life in the Walker neighbourhood of Newcastle. Our neighbourhood team will be knocking on each door in Walker and asking questions like, what do you like best about living in Walker, and what are some of the challenges and what you think could be done about them? Once we have chatted or met you at another local venue, you may wish to explore gaining further support. We provide a warm, friendly welcome and a cuppa at our Treetop Village office. We'll provide a confidential space where you'll be able to see one of the neighbourhood team who'll be able to help you to identify what changes you would really like to make in your lives. We appreciate that telling your story over and over can be distressing and confusing, so we aim to be a one-stop shop where our team can introduce you to the right service for you, where you don't have to keep retelling your situation. Through conversations with the community, we have supported the development of a number of different groups, from community coffee mornings to well-being and gentle movement. Community members are always at the heart of these groups, and there really is something for everyone. I've met so many new people, I've joined some groups. I'm a lot more confident, I'm getting out a lot more like a new person. It's sure enough for me because I had cancer at Christmas. Coming here, it keeps us warm. It's so good to feel that you belong somewhere, and just to see people coming here. That's why with every occasion I have, I tell my neighbors, I tell people on the street, really, this place has stood me well. It has done me really proud. I've met a lot more people, you know, my life's a bit more enriched, I think.
The best thing I can come here, I've got a couple of young friends in here. I couldn't have reached through. And I can't know the horses who work alongside it, and they're brilliant people. I could be on for about ages saying how good it is, but just come and experience it because you'll get a really warm welcome. It's fantastic. Not too many people get help like here. They don't know, they think it's only job centre. There is everything what they need in a life. It's here. Please come.
We can also introduce you to the range of other programmes on offer through Building Futures East, based at our Walker Riverside location, including East End Women, Soul Sisters, Employability and Training, and the East End Food Bank. We can't wait to see you, so please get in touch.
So a huge thank you to everyone that was involved in making that film, all the community members, the volunteers and the staff members too. So I'm going to start by speaking today, then introduce you to Claire Leyden-Baptiste, who's our Health and Casework Manager later on. So for those that aren't aware, just thought we'd set a bit of scene around kind of the Walker community. For most of you that will be aware that Walker is in a neighbourhood to the east of Newcastle, heavily involved in coal mining in the early 1700s, and the industry kind of continued into the ship building, which declined over the past 50 years. So obviously with that decline has brought huge levels of unemployment. And because of that, Walker is the most deprived area of the North East and the 32nd in England, and with higher than average reported crime rates. And with higher than average long-term health conditions, which Claire will talk about a bit later on too. In terms of the project Lifting Neighbourhoods Together, we know that John spoke about this earlier, what the difference is, and I think one of the main differences, for me personally, is in the relationship building. So we really start with the relationships, not the services. We truly listen to people, so we do that through going out, door knocking. We've knocked on nearly 4,000 doors in the Walker area, and we have that listening conversation. So we don't go with flip chart paper or anything like that. We go and we just truly listen to people and have that conversation about really, what's going on in people's lives, what are they enjoying, what are the things that challenge them as well. And then from there, we invite people to come into our office at Treetop Village, and we can provide a warm, nurturing environment. We have nice, comfy chairs. We always have an urn on with teas and coffees. We have one of our community members as a volunteer, Kerry, here today, who acts as a meet-a-greeter. So when community members come in, they get that lovely, warm welcome, and just a chance to sit down and have a cup of tea. So they're not hit by kind of, immediate barriers when they come in. The office is in the heart of the community, which is really important. So we're fully accessible. We're well known in the community, right next to an Aldi supermarket. And we have over 55s accommodation provided by Your Homes Newcastle above us as well. And like John spoke about earlier, we very much start with what are the things that are really important in someone's lives? What are the things that are really going well? We're not there to think about let's just fix that immediate problem. Let's get the full picture of that person's life and start with those good things. And we provide that whole person support, so we truly listen, empower, and we don't assess. So we start with that holistic conversation, and that is looking at every aspect of someone's lives and asking them what they would really like to change. What are the priorities for them and what they would like to change? Not what I think someone should change, but what they really want to do. And we go the extra mile. We can act quite quickly. We had a gentleman the other week who had a bike. He bought it cheap off someone else. Didn't work, something wrong with the tyre. So we told him about another service. It was Kids Cabin, another great service in the area that was doing street work. And we said, go along with your bike, gave him the details. He couldn't get there. So what we did is we put the bike in the back of the car and we took him and we helped him with Kids Cabin to mend his bike. And now he's able to go out on that bike every day. His health's much more improved and he's able to kind of access more things as well. So we can act that much quicker. And we stick with people for as long as it takes. So we don't say we're going to work with you for 6 weeks, 8 sessions, 12 sessions, whatever it is. We leave that open to the person. But what we find by doing that is it reduces that sort of panic and that reliance. And actually what happens is that people do move on quicker, because then they move on, they get their confidence, they're working on the things, they feel empowered, they're working on what they want to change. And then they might move on and go into some of the groups that are going on in the area, or connect with other community members and other volunteers, or they might actually choose to volunteer themselves. All the support that we offer is in person. We find that a lot of community members who come in to Treetop Village, they might not be able to access online services. They may struggle with using the phone to ring someone up. So we offer that in-person support there and then. John talked earlier about the crisis support, and it's really tricky. We get people who haven't got food on the table, they haven't got gas and electricity, and it is really tricky to pull back from that. So we do support with what is that immediate need, what is that driver that has brought somebody to us, but we do that in a different way. So we do the holistic conversation first. Even if they've come in, they haven't got any food, they haven't got gas and electricity, we say, okay, let's go and have a chat, let's have a cup of tea, and we ask those very specific questions around what's going on in their whole life. And then, if obviously the food's important, we will ensure that we can meet that need immediately. And we do that through our partners that we work with. Removing the barriers that are there. And we support community members to develop peer-led groups strengthened by lived experience. People that come and have one-to-one support, they might often be seeing one of our community champions, which we'll talk about more extensively. And from there, we tend to find that actually people might see another volunteer, someone that lives in the community, and say, actually, I could do that too. You're volunteering, you started off coming here, maybe I can have a go at that. And before we know it, we've got groups that have been developed by people living in the area. And that really is strengthened by that lived experience. Claire will be talking more about this in depth later. And we really couldn't thank our community champions enough. So we now have 11 community champions, all living in Walker. Most people who have come in some respect through Lifting Neighbourhoods, they might have attended a group, we might have knocked on the door, and then they've said, actually, we want to give something back to our community, and we want to do it in a really authentic way. And I thought I might get emotional when this slide came up. So the community champions really are the superheroes of Lifting Neighbourhoods Together. They are the heart of the programme. They absolutely bring it all together, and we just couldn't do it without you. So thank you all here today. I just kind of lifted a few of the quotes that you heard on the film. And I won't read through them all, you can read them in your own time, but I think one of the things that stuck for me was a couple of community members said, I feel proud, and I thought that was really interesting. It really showed for me that people coming to Lifting Neighbourhoods, being a part of the whole process of Lifting Neighbourhoods, are not seeing it as a separate service. People are seeing it as part of them, as part of the community that they are really inputting into, and feeling that level of pride in something. But of course, we couldn't do it without all the amazing partnerships, all the amazing organisations in Walker and beyond Walker as well. And when we started out, we really started by thinking, who are the trusted organisations in the area? Who's been here a long time? You know, we knock on doors, we hear parents say, oh, you know, I went to the Bostium, my kids go to the Bostium, they go to kids' cabin, and there's that level of trust in the area for these organisations. So we started by building the relationships with these organisations, and none of those organisations were precious. They were amazing. They said, yes, if you want to come in and do something here, come in and do it. Claire went into the Bosty to their Monday Matters group, which is a really well-attended group, and started to just build relationships there and talk about health. And from there kind of developed, you know, what people wanted, and they wanted some people within that group wanted to think about some weight loss. And what Claire did was build up that relationship. So now there's a volunteer within that group who actually has a set of scales and has some kind of meal plans and things like that. So the group has actually taken that on themselves within that already existing amazing group. So it's about kind of us using what's out there already to kind of think about how we can kind of further make changes. John obviously touched on time donors. So as part of the Lifting Neighbourhoods Together programme, it was very much kind of anticipated initially that time donors would come from internally as an organisation, externally as well. And what we've found is we've been really well supported by external organisations and internally too. We have I'll talk about it a bit more in a second, but we have a one-stop shop on a Monday afternoon. And we've now got Emma Donaldson, who I know is here today from Your Homes Newcastle, who comes every Monday afternoon to help people around financial inclusion. We've now got Lynn from the energy team of Citizens Advice, who's coming along to that those sessions as well as all the other support that we're able to do internally too. We've also linked really heavily with Mine, and we've got Heather Farrow here today. Sorry, Heather, to put you on the spot. And Heather has also been one of the only time donors who's done the training for the holistic conversations. So Heather will also be able to use that and help kind of do casework within Lifting Neighbourhoods as well as her own role at Mine too. We've linked in really strongly with more statutory services as well, and I think that's been really, really important. So with Newcastle City Council community team, especially Helen Pearson, who I know is here today too, and that's really helped to like link kind of Lifting Neighbourhoods with other services and what's going on throughout the city as well. And as part of that, we were involved with the collaborative warm spaces. So there was funding available from Newcastle City Council to provide warm spaces over the winter, and what we did was we collaborated with lots of different organisations locally. So we were able to bring everyone together into one place at Treetop Village. So there was provision of food, activities, Monday to Thursday. And even though the funding stopped from that, we've able to continue with 2 coffee mornings, one through mine and the other through Your Homes Newcastle and ourselves. So it's kept that connection within the community, which has been brilliant. We've also linked heavily with Epic, who I know Linda Nelson's here today, so thank you, Linda. And that's been absolutely, it's been amazing. So what we've been doing is when we've been door knocking and there's been themes of antisocial behaviour where people maybe haven't been feeling safe in their homes, we've been able to feed that back to Linda, who's been able to maybe put on some community safety events at Treetop Village or flyer drop in certain areas, really helping the community to feel safer. We've also had further discussions with the local authority, which has then led to the Newcastle Community Pantry being set up in Treetop Village, and that's an initiative through West End Food Bank and the local authority. And that's on a Monday afternoon, so we've combined that with our drop-in, so there's provision for the community across that Monday afternoon and Monday morning with a coffee morning, so it's feeling like a really nice space where people can come, feel safe, have that dignity and respect, but also have some of those needs met that they might be struggling with. We've been linking with local schools and attended some school team around the school meetings, and also meet regularly with the local police to again input kind of in those you know, some of those themes that we're kind of coming across that aren't being reported as well. We've also got a really exciting partnership with the arts department, so Ali Flanagan-Woods here today. So just in terms of reaching out to the community, you know, we always think about we must reach out to these areas where people maybe aren't coming into us. So near Treetop Village, there's 3 high-rises, and we've just started to get kind of a few more residents who are living there, coming to Treetop Village, having conversations with us, but not enough. So we thought, how do we go in? How do we kind of link in with people living in these high-rise accommodation? I had a discussion with Ali around, you know, how art can kind of, you know, work in there as well. So we're going to be setting up some listening conversation spaces within each of the tower blocks over the next coming months, where we'll have an artist from the local authority along with ourselves doing those listening conversations, probably in the foyer area, getting people to hopefully come down, have those conversations and lead to next steps of that support. I just put a couple of photos up here. Some of the community pantry that's going on, some of the events we've had. One of the events we had in February, we had 300 people from Walker attend that, which was a bit more than we thought, so there was a bit of panic on the day. But it just showed actually how the community really wanted to come in. It really opened Treetop Village up to the community as well. I think with COVID, the doors obviously had been locked, and there was a community didn't realise they could use the space there at Treetop Village. So now that's really opened up. And I see kind of, you know, other organisations coming in to meet with people and have a coffee as well. So it's a great space, and we're really lucky to have the flexibility of Your Homes Newcastle to use that space as well. I know John already spoke about the neighbourhood team, a one-stop shop for support and community. It was interesting, I think, at the Community Renewal Conference, I was talking to somebody on one of the tables I was sat at, and he said one-stop shops can work really badly, and actually I agreed with him. I said, yeah, I totally agree. What we try to do is ensure that for every person that comes in, that they still start with that holistic conversation. So again, if someone comes in, they want a food parcel, we don't start with that, we still start with the holistic conversation. That can be tricky in practice when you've got quite a few people who want to come through the door, and they might just say, I just want help with my energy. You know, am I sitting having a conversation? But actually what we've found is by doing that, it's opened the door to so much more support for that person and really got them to think about what it is that they want for their lives. So I just wanted to put a slide up here just to kind of almost demonstrate the differences we're talking about. So here you can see practitioner, great practitioner. We're not taking that away from that person at all. That person is standing there, you know, obviously had that session with the person at the bottom. Great to speak to you. I think you need to look at changing X, Y, Z, and I'll refer you on to X, Y, Z. I mean, I've worked in services for 20 years, and this is a really easy thing to fall into. I've done it. I'm sure most of us here have done it. Someone presents with a need, That could be around the substance misuse, it could be around housing. So I know we'll look at this with you. But actually that person might think, that's not really what I want to change at the minute. I want to change something different. But before they know it, they've been referred on to 3 organisations. So they've been referred on, okay, you'll wait for a phone call, or you might get a letter through the door, and away the person goes. And they're already thinking, well, I don't really like answering my phone, or I don't like opening those letters, and I'm confused. And before you know it, they might not have attended those appointments. And then the class does not attending, and then they're off the list again, and then they're back to square one. So we kind of look at this as much more of an equal partnership. In the office, in kind of, we do have some one-to-one rooms. We try where we can to take the desk away. We try to remove some of those barriers that make people think, okay, you're up here, I'm down there, you know what to do, you know how to fix me. We try to reduce that and have people, it's very much more of an equal setting. So the kind of the terminology used is quite different. So great to see you told me you would like to prioritise your housing situation. Is that right? So we're always asking back, is that right? Have I heard you right? Well, I can introduce you to a colleague who can help with this. So in a lot of situations then we can come, out from the session and, if it's housing support, we could introduce you to, one of our volunteers like Rachel, and then they have that conversation. So it feels much more friendly. You're removing that kind of assessing, that referral, that kind of, the terminology. Then automatically the person, yeah, that would be great, as I feel comfortable coming here now. And people, when we did the film, it really surprised me because I was sat in on a lot of those kind of interviews, and people were just saying, you get a warm welcome. I think everyone said it's a warm welcome. I like coming here, it's a warm welcome. And that struck me because I thought that's what we want to achieve. If nothing else, it's a warm welcome where people feel safe, they can come in, and they're happy to be there. I won't go through all these, obviously, these figures here. But these were to the end of July, so it just shows in terms of obviously staff members, it's just myself and Claire, and we have some internal help, we have some external help, and often that external help is from the community themselves. But a lot has been done over the last few years, and we are really proud of that. So I'm just looking at time. I'm just going to quickly read a quote from one of our partners. So, put simply, the Lifting Neighbourhoods project and the dedication of the staff team in Walker has changed the lives of local people for the better, in some cases forever. The difference for me is clear. They have time for people. They are invested. Residents go on a journey which doesn't happen overnight, but that's fine. Trust develops, change happens, and they see through. You can see by the level of volunteering and the buzz about the place at Treetops Base that change is happening and people want to be a part of that. So I'm now going to hand over to the lovely Claire Leyden-Baptiste, who's our health casework manager.